My name is Scott Patten. I'm an epidemiologist here with the Department of Community Health Sciences at the University of Calgary. Epidemiology is a discipline that studies the distribution and determinants of disease in populations. That means that it's a discipline that studies what risk factors are causing diseases and also what factors might determine either a better or worse outcome from a disease, such as factors that affect prognosis or mortality that's associated with diseases. And the discipline also extends beyond studies of risk factors and prognosis into some of the most important determinants of prognosis, which are medical treatments. So in addition to the traditional public health perspective, informing prevention, for example, that epidemiology offers, the discipline also is one of the most important ones in terms of guiding and evaluating the impact of medical interventions in healthcare. The discipline, because it provides students with a good, solid background in research methods, graduates of epidemiology graduate programs can work in a whole variety of different contexts. Some of them work in government around policy issues. Some work in the public health sphere in developing and delivering public health interventions, whereas also many clinicians have a background in epidemiology where these principles help them with problems such as evaluating the impact of treatments, better diagnostic procedures, and so forth. The department here is an interesting one because it's very well connected to virtually all of the clinical disciplines in medicine. So we have epidemiologists that share in common a really detailed knowledge of research methodology, but they also work in a whole bunch of different areas. Ranging from mental health to cardiovascular health to cancer and many more fields as well. So the program combines a sort of a core training in the skills that epidemiologists need, therefore can really provide them with a good background for entering into the field of health research. It's been really interesting that even though this is one of the original disciplines in informing public health, that rather than becoming less important as medical technologies have advanced, the disciplines actually become more and more important. And I expect that will continue to happen as the questions and challenges facing medical research become ever more complex and ever more sophisticated. Epidemiology will continue to grow as a discipline in terms of informing those developments.